Priscilla loves being a mom, but newborns give her some trouble.
I'm not really feeling like, oh, I love her. I don't even know who you are yet.
Look at, she's such a little alien. Look at her face.
Jeff is challenged by baby time too.
Screaming and yelling and just wants your attention and still trying to remember, what am I supposed to do?
Will daughter number 3 tear this family apart?
It's very real now.
Go home.
Mommy's a basket case.
She became like overwhelmed.
The intimacy thing is a problem.
Dad got sleep last night, Mom not so much so.
Hi, baby.
Priscilla was a born mother. You know, it was all she wanted to do. When I met her, you know, one of the first things she said, you know, I just want to be a mother.
Priscilla also wanted to find a good father for her future children.
I think I'm quite logical. Like even, you know, who I married, I kind of had a list of things like non-negotiables. And so when I found someone who kind of fit that bill, I kind of got my wheels turning.
Jeff's motivation was a little more primal.
What attracted me to Priscilla was, well, she was just a hot girl who was hitting on me, so I was just all over it.
He's just such a good dad. He's so loving and so easy, and he loves to play with the kids, and he just is the perfect, you know, dad type.
Now Priscilla has the husband and the family she's always wanted.
Becky is 3 going on 4. The tickly monster's gonna get you. Upside down monster! The tickly monster! She's our little willful, independent little child. It kills me she says uncle. Emily is just turning 2.
Do you want a pretty necklace too?
And she's our girl who wants to give us lots of cuddles and kisses.
Mama.
Mama.
You know, it was funny because Priscilla had made the odd comment about, well, maybe we shouldn't close the door on kids yet. And I was like, no, no more. So it's kind of funny that just by chance and by accident, we had number 3.
I'm a stay-at-home mom, and I felt like I could do 3 kids, and I felt like, you know, I was sort of selling myself a little short with just, you know, shutting the door at 2. I think the thing is that we both kind of know the next, you know, 9 months are going to suck. We know neither one of us is really big on the newborn stage.
The sisters may not be big on it either. They will be forced to share a bedroom while the newborn gets her own space.
All we've really had to do is just, we had to buy a mattress. We rearranged Becky's whole bedroom. We just kind of moved Emily into Becky's room. I think it's nice to share a room.
The girls may not think it's so nice, either sharing a room or their parents' attention.
Did you hear that one too?
Parents have a role to play in whether or not their siblings are more apt to be competitive and be rivals, or whether they settle in and get along with one another. One thing that parents can do is to honor the fact that for them, maybe, yeah, they don't like it. Maybe there is some jealousy. And it's much better to affirm that. You know, I can see that you're really not feeling like you'd like to love her like your sister, as opposed to saying, oh, come on, you do so love her. I think that's very dismissive of a child's real feelings. And with time and common experience, they will grow their own relationship. We can't broker it. We can't match make it for them.
Yeah.
And she goes,
Priscilla is due in 2 weeks. She'll have this child the same way she had the other 2, by C-section.
thank you.
She's had one not so good birthing experience followed by a cesarean section. I was leery about flying. These 2 major issues with her have been the fears or concerns about the repeat cesarean section. Yeah.
It's still kind of freaky, you know, going into the hospital and having a spinal and then having someone open you up and knowing that there's going to be, you know, some pain with that afterwards during healing. So I'm thinking about that more, that it's coming closer.
Priscilla has a reason to be concerned. The mortality rate during a C-section is about 3 times greater than it is for a vaginal birth.
So what can go wrong at a C-section? I mean, it can be perfectly flawless to complications with your intravenous, to your anesthetic, the surgical technique itself, bleeding, wound separation. I mean, the list goes on and on. It's the same complications as any operation.
So 2 weeks, I'll see you back.
Sounds good.
Thank you.
Take care.
2 weeks after the doctor's appointment, it's time for Priscilla's surgery and the baby's arrival.
Now I'm getting nervous.
I'll be fast. Big needles. Don't worry, it'll be easy breezy. I'll be there with you soon.
I think the thing for me that I'm having a hard time wrapping my head around is just to think that we're actually going to have a newborn again. Like, that just seems so strange. I'm not sure whether it was just because this one isn't planned. I should be prepared after 9 months, but I just feel like it's just weird. I don't know. I can't really get my head around that.
Coming up, baby Holly arrives, but Priscilla is worried that her maternal instinct isn't kicking in.
I love her because she's my daughter, but I'm not really feeling like, oh, I love her.
Priscilla and Jeff are about to have their third child, and they're not ready.
Now I'm getting nervous.
I'll be fast.
A third C-section is adding to the stress.
I'll be there with you soon. Hey, honey. How are you doing?
I feel weird.
You feel weird?
Yeah.
Well, I think it's okay to feel a little weird.
During the C-section, I do feel a little bit, removed from what's actually happening, just because it has nothing really to do with, me and my thoughts, or, I have no say in what's happening in the surgery itself.
So Priscilla, we're just going through your previous C-section scar. Here comes the pressure that we were telling you about.
The baby is almost out, but Priscilla is left out of the action.
And I think it'd be neat to actually see it, but clearly that's not a possibility when you have a C-section. I felt her come out of my body like this really quick whoosh.
Hey, Papa.
Oh, wow, that was fast.
See your little one?
Yeah.
Stand up.
It was a little surreal when the doctor asked me to stand up and look over the curtain and see the baby. Just the heads popped out, so don't know yet.
Loose the cord. Round, nice, loose though. And here comes your baby. Okay, Dad, have a look.
Wow.
There she is.
Baby girl.
She's out.
It was a little freaky seeing her like that for the first time. Yeah, seeing this head poked out of someone's tummy with blood all over and everything. Yeah, it was a little surreal for me because I'd never done that with any of our other two kids. I was like, wow.
Bring her around here. You can have a look at her. Oh, look at.
Oh, she's a big girl. I knew she was big. Oh my God. Oh, good.
Good healthy cries.
2 girls.
Yeah. 3 girls. Are you ready for 3 girls?
There you go, Mom.
Priscilla and Jeff now have a third daughter, Holly, weighing in at 7.5 pounds.
Still trying to remember, what am I supposed to do? I can't remember. I'm not necessarily a baby person. I think with all 3 of my kids, I had a hard time really connecting with them as babies. To me, they were something that spat up and cried a lot, and it was hard for me to connect with our kids. Rockstar.
The woman who loves being a mother finally gets to spend some time with her brand new daughter.
I have a little bit of guilt that I'm looking at Holly and, I love her because she's my daughter, but I'm not really feeling like, oh, I love her, because I don't know her, because I'm comparing it to my relationship with Becky and my relationship with Emily, and I've known them for several years, and I feel very bonded to them. And I'm looking at Holly and I'm thinking, I don't even know who you are yet.
Priscilla struggles to get to know her baby. But for some women, the problems run much deeper. They feel no attachment at all when their child is born.
I love you, sweetie.
I think any time a mother hasn't bonded with a baby, some kind of action has to be taken. You can't just wait for it to run its course. The best case scenario in a situation like that is that the unattachment is the direct result of a postpartum depression, because postpartum depression is very treatable. So a little psychotherapy, a little medication, the mother can be back to herself in a matter of weeks. Then she can attach to her baby and get back to the job of helping that baby become a person.
She's an alien. I told you she was an alien inside of me.
Yeah.
I think you realize after you've had a couple babies, you don't have to always say what is the most, flattering thing about your baby. You can actually look at your baby and say, yeah, the baby looks kind of funny. You know, I can look at her and say, gosh, those are, you know, scrawny legs, and my gosh, that's a poor excuse for a bum.
The next day, Priscilla tries again to bond with Holly.
Yeah.
After delivering, a woman's emotions can be conflicted. 10 to 20% get full-on postpartum depression. 80% get the baby blues. For others, any emotional attachment to their new child may take months.
I mean, I never really pressure myself to feel like I have to be in total love like the first moment I lay eyes on her, you know? Because you don't really know this little person, and you're just getting to know each other. But we're going home, and we give some presents to Emily for her birthday. Birthday cake! Birthday cake!
It's a big day, Emily's second birthday. It's the first day home with Holly, and the parents are already tasting their new life, taking care of a newborn and trying to throw a party at the same time.
So, of course, you know, there's only so much you can do when you've just come out of the hospital from a C-section, but, you know, we wanted to make it special and, you know, mark that day for Emily.
Everyone recovers from a C-section at a different rate. Usually, women can resume normal activities after 6 weeks.
If you were healthy before you went in, of course, that makes it better. If you have multiple medical problems, that's going to make it more difficult to recover. You know, if you're a sick person, your tissue turgors, and it's just not as good. So it may take longer. But for the most part, I think just a healthy lifestyle helps you to recover quicker.
Daddy doesn't even know who you are yet.
She looks like an old man waking up from a nap.
Coming up, two's a crowd as Emily and Becky move into the same room to make way for their new sister. Priscilla and Jeff have just had their third daughter, but bonding with their new arrival has proven harder than either of them had envisioned.
You know, I love her because she's my daughter, but I'm not really feeling like, oh, I love her.
The first week that Holly was home, I was really just trying to take care of the girls, make sure they stayed out of Priscilla's way as much as possible so that she could focus on the baby, and just really help out Priscilla as much as I could. Arms up. I'm worried about Priscilla getting drained, like just dealing with the baby and 2 kids all day. I'm just worried that it's gonna take a toll on her, and which will take a toll on me.
Jeff, are you bringing Becky to bed?
Yeah, she's just going downstairs to get her purple puppy and her blankie.
Hi, Becky.
They like living together in this bedroom. No silliness. Stay in your beds. Time for sleep. Good night.
Goodness. Do you want to
Good
eat
night.
again? You can eat again.
We have a system going where I'm just in charge of, you know, when the baby cries, of getting up, right away, and changing her diaper or changing her shirt if she needs it.
Hey.
Oh, yeah.
Yeah, keys. Sorry, Daddy. Here you go.
How did I know?
Here you are.
So that can feel Priscilla's pain when she has to feed her in the middle of the night.
That's right.
Daddy's lot in life. Dirty diapers.
I don't really feel that bad for you.
Thirst.
Nose that pocket?
Yeah, just, she just peed on her clothes.
Feeling the pain is important. I mean, you just kind of let me get up, and I nursed her all the time. And I think sometimes you even pretend you were sleeping. And, you know, just having that extra just having the extra 5 minutes to get up and use the washroom, and, you know, especially when I was healing, just slowly get out of bed. So in the middle of the night when I'm really tired and I don't want to get out of bed, it's nice to know that he had to get out of bed too.
After a hard night comes a hard day as things get difficult with Becky and Emily.
And here, Becky. Yeah, so she's ordering Emily around this morning, I think. Hopefully Jeff will come to the rescue because I'm just sitting here. They have to deal with it. Let me go see what's going on. That's brutal. Becky. Jeff. Becky's yelling at Emily, and Emily's very upset on it. The baby just spat up all over me.
Anytime siblings share a room, sparks are bound to fly.
They're starting to fight a lot, which is the first. We've never seen that before in our family.
Becky.
And I think it has a lot to do with Emily turning 2, and she's got that terrible 2 thing going on. Emily's pulling Becky's hair, and they're fighting over toys, and it's just, you feel like a referee half the time.
But there are some benefits to sharing a room. It forces the roommates to learn how to resolve conflicts early in life.
One of the hardest pieces of advice for parents to take is the idea of letting their children own their relationship with one another. That they cooperate to fight. I think these kids actually can manage on their own.
Meanwhile, a week after Holly's birth, Priscilla still struggles with bonding.
I mean, I love her because she's mine, but I mean, I don't even know her yet. She's this totally different person. And I don't know, I mean, I cried when she was born, but I mean, I don't think I really felt that attached to her. But I know the feelings will come. We just don't even know each other yet.
Coming up, Jeff and Priscilla continue their struggle to bond with baby Holly, and things get worse in this crowded household. Priscilla and Jeff are both struggling to bond with their third unplanned daughter, Holly.
I often feel like I have to be in total love, like the first moment I lay eyes on her, you know?
Especially as her arrival has unsettled their other 2 daughters. But as time goes by, both parents begin to see a change.
Emily, eat pizza or time out? Emily, time to eat, come on. Emily, you come sit down or go for time out? Time out for not listening. I know. Time out, and I'll come back. I sort of feel like I'm at capacity now. Like before I felt like, you know, I love this, I love kids, like I love my 2 girls. This is my passion. Okay, Emily. Emily, you have to listen to Mommy, okay? Mommy says time for dinner, okay? You go sit down. Listen. Time for you to sit down at the table, eat pizza, okay? Say, okay. Okay. Say, I'm sorry, Mommy. Mommy. Okay, give me a hug. But now that I'm at 3, I'm at my limit. Like I don't think I could do any more. This is a lot of effort. Thank you.
Hi, girls. I've definitely, this time with their 3rd child's given me a lot of time with my other 2 kids. So it's been interesting. I've grown so much with my other 2 kids.
Emily and Becky are getting along better too, which makes life easier for Daddy, but there's still the issue of bonding with baby.
In terms of Holly, you know, she's still, I think she's still somewhat a baby to me, you know, screaming and crying and needing diaper changes and the like, but she's definitely really cute.
Bonding between a mother and child is much more important. In extreme cases, long-term problems can occur if it doesn't happen quickly.
There are critical periods in the development of an infant. One is around 8 to 10 months of age, another is around 15 to 30 months of age, during which, if there is no useful attachment between mother and infant, the infant will develop horrible, horrible personality pathology. We're talking borderline disorder, multiple personality disorder, antisocial personality disorder, malignant narcissistic personality disorder. This is not minor stuff.
Priscilla and Holly have now been together 3 months. There's been enough time for Priscilla to gradually bond with her new daughter.
As far as my connection to Holly, I don't really know if I can pinpoint an exact time when I started feeling bonded to her. Like, I know that I didn't put a lot of pressure on myself to, you know, to feel like love and connection. Like, I didn't feel any guilt, but it does take time. So I think probably it was like 4 or 5 weeks. I really do look at Holly and think that I now feel like our family is complete. Like, I feel like she's like the final piece of the puzzle that we've been working on for the last 13 years. Like, it just really feels like this is what my family was meant to be, was 5 of us.
Night, Holly Dolly.
Yeah, I think that, you know, for Jeff's sanity and for our family, I think that we're gonna draw the line here at 3 kids.
My sanity?
Yeah, yours.